Thanks so much to both Diane and Lisa for your presentations. They were really thought-provoking. So we have a few questions for you now. I'm going to start with Diane. So you mentioned the different frameworks across the UK and the similarities. Did you notice any differences?
Not really. It was really interesting. So I was really interested to see that there were different frameworks. Because obviously I'm from England and I'm really familiar with the multi-professional framework. But actually, when I looked at, say, the Northern Ireland framework, even though it did have advanced AHP on the front, actually the content and the body of it really talks about advanced clinical practice. So really, I think the content was quite core across all the four countries, even though they're slightly branded differently. And I can only think that difference in having those different frameworks is perhaps related to the educational routes, which are slightly different, aren't they, in the four countries? But the actual content was core to all four countries, really.
Yeah, thank you. And we've noticed that you've submitted a poster for this conference presentation, and just wondered if you could actually give us a little bit more information about the work that you did there.
Absolutely. Yeah. So I guess we took the opportunity, like Kim Manley said this morning, sort of seek opportunities. So an opportunity came up to apply to be part of a project team for Greater Manchester. They wanted to do a piece of scoping work to have a look at advanced clinical practice supervision across Greater Manchester for the multi-professions across the multi-sectors. So we had a team of 5 of us that came together from a couple of AHPs, physios, and 3 nurses from advanced practice nurses from different clinical areas. We did scoping work, so we had focus groups. We had 3 different focus groups with the supervisees to gain perspectives from the supervisees across Greater Manchester in terms of advanced clinical practice. We then did one-to-one interviews with supervisors and employers, and then we evaluated that. Really, a lot of the findings were there was no standard of advanced clinical practice supervision in Greater Manchester, which is probably consistent with across the countries. There were challenges with transition from trainee to advanced practice. There was a real desire from the advanced practitioners for having some sort of mentor-mentee platform, so that they could, if they really support them if they worked in a really isolated role, that they could reach out to somebody across Greater Manchester who may work in a similar role to support them with their transition. But also if they were doing, say, an advanced practice project or quality improvement project, or a pathway, somebody that they could link in who could give them some mentorship. So there was a real desire for that. There was a real desire for some supervision tools, which we developed, but we did base them on Ian Sexfield's work from the CPD work, based of the portal. And we did a supervision study day, and we had fortunately had people like Deborah Harding was there to present her work. So yeah, there was a real desire. So what we've done is made some recommendations to our workforce and retention board to take that forward, which is where we're up to now with that.
Brilliant, thank you. So interesting to hear about that work. Thank you for sharing. Um, do physios in a trainee advanced practice role need to work under the same close supervision of medics in order to make diagnosis?
I would say it depend. I would say it depends on the clinical area. So I work in musculoskeletal. We often don't have a medic within the team. So I think if you're in an outpatient setting or in primary care, well, many in outpatient, so a lot of MSK are working an interface service without medical support. So actually, I think you can learn a lot from your peers. We would go to visit various clinics, so orthopedics, rheumatology, we'd do some ward based, but our supervision comes from a range of people. I think for physios working, say, in ICU or respiratory, then they're more embedded as part of a multi-professional team in an inpatient hospital setting, and their supervision would probably more align to sort of the consultant medical model. So I think it varies depending on the clinical specialism and the area of work.
Thank you. Thanks, Dan. So we've got a couple of questions now for Lisa. So first question, as you're funded from 2 streams, Do you ever experience a feeling of not fully belonging to one team or the other?
So I suppose that'd be yes in a way, but so yes to I don't fully belong to pharmacy anymore, although they do put the fund at 50%. I am fully embedded into the ED team and I feel very much part of that. You know, we work very well within that. So I mean I'm on the rota for the emergency department. I don't do a lot of other pharmacy work. So I suppose the traditional pharmacy roles, the medicines reconciliation, reviewing patients. I don't work as a pharmacist anymore, so I'm a wee bit out with the pharmacy. But I suppose if we just think about it, this is actually a different role, and it's how we take pharmacy to a different level with this, you know. So I still do have meetings, you know, with the head of pharmacy. He's very much involved. He's still my professional lead and my consultant, and you know we have sort of yearly meetings and set goals and with that sort of thing. So I fully belong to ED, but I do have a pharmacy background, and they are still involved with me. Yes, yep,
Yeah, thanks. Exciting times for pharmacy, I think, isn't there? Now,
absolutely,
Lisa,
yes.
as well. Yeah.
Yep.
So, can I ask, have you previously undertaken any interdisciplinary education?
Um, so no, it's all been well, it's all like my masters and things like that. Is that what you mean? That's all
Mhm.
been sort of pharmacy, and the prescribing has been. But obviously, from now on, it's more advanced life support, etc. And we have sort of interdisciplinary education sort of on a weekly basis with our teams. You know, so it's more we do now, but it's maybe not a formal education. But for our
Mhm.
courses and things now, then we do. Yep. But all my sort of the masters and everything was all pharmacy
Yeah.
based. Yep.
Uh, In terms of the interdisciplinary education now, then, how do you find that? Do you find that quite thought provoking, and you're able to consider
Yeah,
things through different lenses now as well?
I think it's really good because you look at situations very differently, just from what you've experienced. And I think obviously my first initial thought are always around medicines and drugs because that's where you've came from but there is an actual patient there. So I think when you are around, like we have, like I said, a paramedic and nurses on our team, and it gives you I think that gives a better rounding of education and understanding and how to approach things and people sort of thinking and how you better yourself as well, you know, with that opportunity to be around people that aren't in the same sort of box as you almost. So it is very, very good. And I think you learn so much from it. And it's brought me on, you know, it's obviously brought me on over the past sort of 5 years with doing this. Yep.
Yeah, good, good. So, last question. James is asking, interested in your banding whilst going through training and how this compares to
Mm-hmm.
other trainees and other advanced pharmacists within your organisation.
Don't know why we like to talk about money on here, right? So really, so I suppose I was a senior clinical pharmacist, so I was basically at the top of where you want to be. I've not gained anything, so we say that from moving across to this, although I have done a lot more and have maybe a lot more. I suppose it's just where pharmacists sit, isn't it, on the agenda for change and things like that. So yeah, it's I don't know how to answer that. And yeah, so
Mhm,
I've not really gained anything financially with
mhm.
this. So it is. So I suppose that is a put off for some people because you are
Yeah,
taking on a lot of responsibility and further education, and my banding's not changed. We'll put it that way. Yep.
yeah,
Yep.
that's a shame. Yeah,
Yeah. Yep.
absolutely. It's a whole different role, isn't it, as well? Yeah. Uh-huh.
It is. Yep.
Um,
Yep.
so that's the end of our questions for just now. So thank you both so much for your presentations and for your time. And we're going to move now to Kathy and the start of the annual general meeting.